Basically, nutritional IV therapy, we also call IV nutrient therapy in some cases, is a direct infusion of minerals, vitamins and amino acids and other nutrients directly to your bloodstream. So this way we bypass our digestive tract, bypass the first phase, so that the cellular uptake will be 100%, so bioavailability will be 100%. The main factor that we need IV infusions, that's the bioavailability, because most of the medications we cannot have the same bioavailability through the oral route. For instance, if you talk about vitamin C, oral route we cannot give a higher dose. Okay, the peak value for vitamin C is 200 milligrams. Okay, the oral absorption from the gastrointestinal tract is only between 20 to 30% of whatever you take. So even if you are taking 500 milligrams of vitamin C, your body will only absorb maximum of 200 milligrams of vitamin C. So in some cases, in some treatment modalities, we need to use a higher bioavailability, for example 10 grams, 15 grams, 20 grams, and which is not possible through oral. It will have a huge impact on our digestive tract system. So glutathione, everybody knows, is a master antioxidant. So glutathione, if you take orally, 90 to 95% will be destroyed in our GI tract, destroyed by stomach acid. So the only way to get 100% glutathione will be through IV treatment or through other forms of glutathione. Vitamin B12. Okay, so if you are taking vitamin B12 in our body, if you take oral or through the food, our body needs a certain condition, certain intrinsic factors for vitamin B12. If you have some issues, then your body will not absorb the required amount of vitamin B12. Then those persons, the way they process vitamin B12 will be lesser than the normal person. Also, to avoid all these factors, so intravenous or intramuscular vitamin B12 injection can give 100% bioavailability. That will help. It's the same similar way if you talk about fat soluble vitamins like coenzyme Q10. So coenzyme Q10 also the same thing. It's a fat soluble vitamin, and if you take oral forms, it only takes 20 to 30%. It's too less sometimes when you need a therapeutic effect. We have to reach the therapeutic effect that cannot be done through oral vitamins. So we need to have a 100% bioavailability through IV treatments.